Hello, how are you doing, guys? With you today, Dr. Muhammad Hamid, an ECVMG certified physician. We've got a high yield case for the microbiology for the USMLE Step 1 exam, and it talks about malaria in general and specifically malaria prophylaxis. So, this is a 45-year-old woman presenting with a fever and fatigue 2 days after returning from a trip to Africa. And she took miflukin during travel, but stopped it immediately upon return. Blood smear like shows Plasmodium falciparum. And the question asked what explain her current symptoms despite prophylaxis. Pause the video and think about the correct answer. And the correct answer is exoerythrocytic tissue schizoid. So first, we got to talk about like the malaria life cycle. It started with the Anopheles mosquito. It bites your skin and the sporozoid enters and it goes directly to the liver. It lies dormant in the liver through something called schizoid, and the schizoid is gonna rupture and mucoid is gonna spill into your blood and go into some asexual blood stage in your blood, and some go into gametes and go back when the mosquito feeds again on your skin and to like complete the cycle. So very high yield to know that the schizoid is like intrahepatic stage. So this intrahepatic stage is gonna stay up to 30 days or 4 weeks. This is the reason you have to give miflukin up to 4 weeks after travel. So if you, as this our patient here, she stopped like miflukin upon her return and she didn't continue it for up to 4 weeks. So the T-zones that were lying dormant in her liver ruptured after some time and released like mucoid and completed like the sexual blood stage. So this is what is wrong here with our patient. And let's talk about other choices. Chloroquine resistant strains. So this is a wrong answer. So this patient like went into Africa. There are some areas endemic in Africa which has like a high chloroquine resistant strains. So in this case, you can give one of three drugs, either miflukin as our choice here, which is a correct choice, also like doxycycline or atopic-1 briguanil. So you have to give either one of these drugs, and it has like a high activity against the chloroquine resistant strain. Number B circulating gametocyte, wrong answer. This is not the cause of the persistence of her symptoms, but the cause, as we have said, is like she didn't complete it for 4 weeks, completed treatment for 4 weeks upon her return, and the schizoid was dormant in the liver. So dormant liver hypnozoids is also a wrong answer. So you have to know that the schizoid is pretty like a common pathway for Plasmodium vivax, Plasmodium ovale, and Plasmodium falciparum. Versus Plasmodium vivax and Plasmodium ovale have a specific dormant infection, which is the hypnozoid. It's gonna stay in the liver up to several months versus the schizoid, which has like maximum up to 30 days. So the dormant liver hypnozoids are specific to Plasmodium vivax and Plasmodium ovale, and our infection here, which is Plasmodium falciparum. So this is the wrong answer. Exoerythrocytic tissue schizoid. So we have like intraerythrocytic schizoid and extraerythrocytic schizoid, aka like liver schizoid. So this is the cause of infection. Miflukin is like pretty active and they can like tackle schizoid, intraerythrocytic schizoid, or intraerythrocytic trophozoite, and it is inactive. It is inactivated by the liver, so it is inactive against the extraerythrocytic schizoid, aka liver schizoid. So you have to give it and continue the treatment and waiting for the liver schizoid to rupture, to like capture it and kill the organism in the blood. This is the rationale behind giving it for up weeks. So our correct answer is exoerythrocytic tissue schizoid, which caused like the resistance of infection, and the last choice, which is intraerythrocytic trophozoites, wrong answer. So the intraerythrocytic trophozoites is gonna like rupture after either 12 or 24 or 48 hours, and this is the cause of the cyclical fever in the malaria. So it is not gonna stay that long. It is not the cause of like persistent of the symptoms after a long time. So I hope you guys enjoyed our video today, and see you guys in next videos.